I've been working with iNPH patients and hydrocephalus patients in general and shunt surgery for 20 years now. I'm Rafael Holmgren. I'm a board-certified Swedish neurosurgeon. I'm subspecialized in pediatric neurosurgery and head of pediatric neurosurgery here. My research focuses on volumetrics and proteomics in hydrocephalus, more specifically Idiopathic Normal Pressure Hydrocephalus, which is a disease of the elderly. As neurosurgeons and neurologists, we face certain challenges with these patients. Initial symptoms of iNPH are usually vague and can often be confused with normal aging. When they come to us, we'll meet an experienced neurologist for clinical examination and history. They'll go through lumbar puncture to get CSF biomarkers, and we'll do imaging, which is most often DT and then also MRI. So there's good scientific evidence that ventricular volumetry is a far more sensitive method to detect shunt-induced reduction of ventricles and CSF in hydrocephalus patients. However, volumetry has been too complicated and time-consuming to take its place in clinical practice. So we still stick to the traditional 2D measures, such as frontal horn width and Evans index in everyday practice. By making volumetry easy and accessible, me and many in the scientific community believe that it can help us to identify even subtle changes in brain shape and volume, and that may indicate treatment response and disease progression and maybe even shunt failure as a reason why patients get their symptoms back. Quantitative MRI can provide more detailed insights into brain structure and function, allowing for improved diagnosis and monitoring of iNPH. QMRI, quantitative MRI, along with SyMRI, have been a part of my research since 2021. If you have a baseline scan of volumetry before shunt surgery, and then have your shunt implanted and come back 3 months later for follow-up, if I get a new MRI scan when you're feeling improved from your symptoms, I'll have something to compare with if you come back sometime later and feel unwell again. We believe this will save patients suffering, unnecessary invasive procedures, and the risks that come with those. And to the patients, this means improved quality of life and reduced anxiety about their health condition, and of course, avoidance of risks. I believe that SyMRI has the potential to give us what we need there to take our understanding of iNPH diagnostics and especially monitoring after shunt surgery further.